Welcome to Raaonline teaching program. I am Dr. Monica, a pediatric faculty. So today's video is going to be about the neonatal scores. I have taken 3 important neonatal scores which is used in the neonatology at the time of resuscitation and to assess the severity of the respiratory distress in the newborn. So they are Apgar score, which is mainly used at the time of resuscitation of the baby, and Silverman-Anderson's index and Downey score. These 2 scores are used to assess the severity of the respiratory distress in the newborn. So it is like a ready-made shots to revise the scores. So moving on to the first one, which is the Apgar score. So Apgar score, you all be knowing like what are the 5 parameters that is being used to assess the Apgar score, which is the color of the baby, heart rate and reflex irritability, muscle tone and respiration. Okay, so color of the baby, heart rate, reflex irritability, muscle tone and the respiration. So based upon the severity, they have given scores from 0 to 2. So all the 5 is present completely, then for out of 10 you will be scoring. So out of 10 you will be scoring the Apgar score, and this Apgar score you will be evaluating immediately at the time of delivery, that is the 1 minute Apgar and then 5 minute Apgar, and after that every 5 minutes you need to assess the baby based upon the requirement. If the baby is requiring resuscitation, then every 5th minute you will be keep on assessing the 5 parameters. So if the color is completely pink with a heart rate of more than 100 per minute and the child's cry is very normal and active withdrawal is present with active motion of all the 4 limbs and with a good crying respirations, then you have to put score 2 of all the parameters. And if the baby is acrocyanotic, that is centrally there is pink but peripheries are blue and heart rate of less than 100 per minute, showing only just a grimace, not with active form withdrawal, and there is no spontaneous activity of all the 4 limbs, slight flexion is present, and there is a weak cry with hypoventilation, then you have to score it as 1. And if the child is completely blue or pale or absent heart rate with a no reflex response, or the muscle tone is like limp and respirations are absent, then you have to score it as 0. So these 5 parameters are taken into consideration while doing the Apgar score. And if you see, this 1 minute Apgar does not guide the resuscitation. It is basically this 1 minute Apgar, it correlates mainly with the umbilical cord pH, and it shows only the intrapartum depression. So that's why this 1 minute Apgar does not guide the resuscitation. This 5 minute Apgar is very important. Okay, this 5 minute Apgar is very important. If the more than 7 score is good. If it is somewhere between 0 to 4 means, then that indicates there is some neurological disability or neurological abnormality you have to take care of. So more than 7 score is good. Anywhere less than 7 you have to evaluate the baby every 5th minute. So what is the drawback in only looking these 5 signs is, in case of very low birth weight babies, even when the Apgar is less than 3, they are having normal neurological outcome sometimes. So because of this, to overcome this flaw, the American Academy of Pediatrics have come up with the expanded Apgar reporting form. In this expanded Apgar reporting form, along with the regular 5 signs, another 7 signs been added, which is like for example, a mnemonic is been given, which is combined. Okay. It is, the expanded Apgar is nothing but the numerical score and also concurrent resuscitation what has been taken. Like for example, if you are providing CPAP or if you are providing oxygen through any mode, if you are providing oxygen through bag and mask, ventilation, or if you are intubating the child, or in case of chest compression, neonatal chest compression. In case of exogenous surfactant you are administering, or any drugs like adrenaline. So based upon each individual resuscitation intervention, you have to score it either 0 or 1. Okay, so either 0 or 1 you have to score. 0 means if you are performing any of this activity, like for example in the 5th minute the child is not crying and the respirations is weak, but heart rate is between 60 to 100, at that time you will be giving positive pressure ventilation. So you will be providing oxygen through bag and mask. So at that time you have to score 0 in all these categories. Like for oxygen you have to put 0 at 5th minute, and if not performed, but you are not giving, but you are not intubating, but you are not giving chest compression, you are not intubating, you are not giving chest compression, and you are not giving any drugs. So if the activity is not performed, then you have to give a score as 1. So it is just opposite. So you have to remember this. So if you are not performing an activity, you should score it as 1. And if you are performing the activity, any of the activity if you are performing, you have to score it as 0. So the normal Apgar score is for 10. Okay, the Apgar score is for 10, but expanded Apgar score is for 17. So total score is for 17. If the total score is somewhere like less than 10 out of 17, then it should be considered significant. Okay, so this is the expanded Apgar reporting form. So this is one new thing it has been given. So it will be easy for you to remember. If you remember this mnemonic, that is combined.